treatment live and today date is 11th of March 2024। तो नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे। तो आप हमारे YouTube चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर लीजिए ताकि जब हम ट्रीटमेंट के बाद लाइव हों तो जो भी पेशेंट्स आज लाइव में दिखेंगे, जिनकी आवाज़ को आप सुनेंगे, उनकी वॉइस में क्या चेंजेस हुए वो ट्रीटमेंट के बाद भी आप लोग देख पाएँ। तो यू कैन सी दोज पेशेंट हु हैज़ कम फ्रॉम डिफरेंट प्लेसेस। आई विल बी जस्ट शोइंग टू देम। So these are the guys. Actual number of patients are more, but few are not comfortable with their videos, so I'll be not be able to show them. So ये सारे patients हैं. And in this live, the topic what we are going to cover, I'm just going to tell one by one. First will be introduction about me, then will be our center, and then will be our YouTube channel's introduction. And of course, we'll be listening the patient's voice before treatment. Those are come today on 11th March 2024. And then I'll be talking on what are the information required before starting the speech therapy, kind of service we provide, high pitch voice, signs, symptom, cause and treatment, vocal cord paralysis, signs, symptom, cause and treatment. Is there any side effect of voice therapy or self-treatment? How to contact us, and do we have accommodation facilities at our center? Which treatment is preferred first, voice therapy or surgery for pitch correction? And do we have any branch of our center? Cost and duration of the treatment for voice and speech disorder. How do we treat international patient, online or offline? And is saying 1, 2, 3, saying in new voice is the stage of treatment or the end of the treatment? Is voice therapy result is permanent? Effect of food and drink on voice, and announcement of next batch of group therapies. That I'm doing now only. Our next batch of group therapy is going to be started on 8 April 2024. तो अगला बैच हमारा जो ग्रुप थेरेपी का स्टार्ट हो रहा है 8 अप्रैल 2024 को स्टार्ट हो रहा है। नेक्स्ट विल बी टॉकिंग ऑन हु आर द गुड कैंडिडेट फॉर वॉइस थेरेपी। इज ऑल हाई पिच वॉइस और फीमेल वॉइस इज प्यूरोफोनिया। ऑनलाइन फैसिलिटीज़ फॉर कम्युनिकेशन डिसऑर्डर एट आवर सेंटर, एंड टिप्स टू कीप योर वॉइस हेल्दी। तो एट द एंड ऑफ दिस लाइफ, इस लाइफ के अंत में हम लोग कुछ टिप्स भी देंगे, आप अपनी वॉइस को हेल्दी कैसे रख सकते हैं इस पर। तो जुड़े रहिए एंड विल बी covering one by one. So first thing is introduction about me. So my name is Sanjay Kumar. By profession I am a speech language pathologist and audiologist, and I have studied from AIIMS Delhi. I did my Bachelor of Science Honours in Speech and Hearing from AIIMS Delhi, from All Indian Institute of Medical Science New Delhi, and my degree name is Bachelor of Science Honours in Speech and Hearing. And I did my Master in the field of Speech Language Pathology from the University of Mysore. My Master degree name is Master of Science in Speech Language Pathology. And my area of interest is, or you can say my passion is treating voice disorder by non-surgical method. बिना सर्जरी का वॉइस थेरेपी के माध्यम से वॉइस डिसऑर्डर को ट्रीटमेंट करना हमारा पैसन है, मेरा पैसन है। And our center name is Sanjay Speech Hearing and Rehabilitation Center, and that is located in Bangalore. Until now we don't have any branch, and if you do the Google search, even you can find out our center. And if you can explore the description of this video, and if you will find the link of our website, and once you click you'll reach to the Google map as well to reach to our center. So those who want to contact us, sometimes people will ask, sir, where is your center? So my suggestion is please refer the description of this video. And next is our YouTube channel. So our YouTube channel name is SLP Sanjay Kumar Voice Therapist, and that we started in the year 2010, and now the year is 2024. So last 14 years with the different success stories video, we are creating hope across the globe with the people having communication disorder, and our client list include people across the globe. Means every continent people has taken services from our center, either online method or offline method. तो दुनिया का कोई भी ऐसा महादेश नहीं है जहाँ के लोग हमारे सेंटर से ट्रीटमेंट नहीं लिए हैं। और अगर आप हमारे YouTube चैनल को देखना चाहेंगे, जो लोग स्पेशली नए हैं, कई सारे लोग नए होते हैं, तो उनको मैं दिखाना चाहूँगा। ये है हमारा YouTube चैनल, थोड़ा सा आ रहा होगा, ये है जिसका नाम है SLP संजय कुमार वॉइस थेरेपिस्ट। और जो होम पेज पे एक वीडियो देख रहा होगा, ये लगभग 35 मिनट्स का वीडियो है, तो इसको आप लोग ज़रूर देखिए। अगर आप हमारे सेंटर पे नए हैं तो सारे कम्युनिकेशन डिसऑर्डर को एक ही वीडियो में हमने कंबाइन किया और प्री एंड पोस्ट डाला है, और इसके डिस्क्रिप्शन में भी जाएंगे तो और भी बहुत सारी इन्फॉर्मेशन मिलेंगे। तो ये रहा हमारे YouTube चैनल, और हम किस तरह का काम करते हैं उसको समझना है तो हमारे YouTube चैनल के प्लेलिस्ट को एक्सप्लोर कीजिए, तो आपको समझ में आएगा कि हम किस तरह का काम करते हैं। और हमारे वीडियोस में जाकर अगर आप ओल्डेस्ट वीडियो अगर एक्सप्लोर करेंगे तो आपको 2010 से 2010 से स्टार्ट होंगे, और आज तक 14 साल से नॉन स्टॉप हम डिफरेंट सक्सेस स्टोरीज़ के माध्यम से लोगों की ज़िंदगी में होप क्रिएट कर रहे हैं जो कि ऐसी समस्या से जूझ रहे हैं, वॉइस की समस्या से जूझ रहे हैं। तो ये रहा हमारा यूट्यूब चैनल। और अब फिर हम आगे बढ़ते हैं नेक्स्ट स्टेप पर। एक है कि व्हाट आर द इंफॉर्मेशन रिक्वायर्ड बिफोर स्टार्टिंग स्पीच थेरेपी। तो इस स्पीच थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए, या वॉइस थेरेपी स्टार्ट करने से पहले किन बातों के बारे में जानकारी जुटानी चाहिए। इसके बाद हम पेशेंट की वॉइस सुनाएंगे जो आए हैं डिफरेंट जगहों से। तो मेरा ये सजेशन है कि एक स्टेप्स बताता हूँ कि सबसे पहले ये पता कीजिए, फर्स्ट यू नीड टू फाइंड आउट फ्रॉम होम यू आर गोइंग टू टेक द ट्रीटमेंट व्हाट एजुकेशनल बैकग्राउंड ही हैज़। कि कहने का मतलब उन्होंने कहाँ से पढ़ाई की है, उनके डिग्री का फुल फॉर्म क्या है, कौन से ईयर में डिग्री प्राप्त की है, व्हाट फ्रॉम विच यूनिवर्सिटी, फ्रॉम विच मेडिकल कॉलेज, फ्रॉम विच स्पीच इंजीनियरिंग कॉलेज ही गॉट द डिग्री, what is the full form of the degree, and which year he got the degree, because many healthcare quacks also write the name of some colleges and the degree, and but those are healthcare quacks, they will not mention in which year they got the degree. And this is the one way. And another way is, I'm just going to tell now, nobody can cheat you in the name of a speech language pathologist and audiologist or a speech therapist if he is a fake. Because I am a speech language pathologist and audiologist, I am treating people, but at the same time my duty is to create awareness how people can know who is the right professional and who is the healthcare quacks. So there is a one website of Government of India called Rehabilitation Council of India's website, and that I am going to show you now, and I am turning the camera now. तो ये देख सकते हैं, ये जो मैंने लिखा है, ये दिस इज माय यूट्यूब चैनल कम्युनिटी पेज. सो वंस यू स्क्रॉल डाउन यू विल रीच टू दिस प्लेस. सो वंस यू विल एक्सप्लोर माय यूट्यूब कम्युनिटी पेज you can reach to here, and step by step I have mentioned. So first is this one, check this rehabcouncil.nic.in. This is it's not my website, it's Government of India's website, and every speech language pathologist and audiologist will be registered to the Rehabilitation Council of India. And even those who are not speech language pathologists, for example a special educator, speech and hearing technician, psychologist, they will be also registered here. So having registration in Rehabilitation Council of India is not a proof that he is a person who is a speech pathologist and audiologist. So that person should be registered as a speech pathologist and audiologist. अगर कोई साइकोलॉजिस्ट के रूप में काम करता है तो रिहैबिलिटेशन काउंसिल ऑफ इंडिया में एज ए साइकोलॉजिस्ट रजिस्टर्ड है. तो उसी तरह से जो स्पीच लैंग्वेज पैथोलॉजिस्ट, स्पीच थेरेपिस्ट, ऑडियोलॉजिस्ट हैं तो रिहैबिलिटेशन काउंसिल ऑफ इंडिया में वो इसके रूप में रजिस्टर्ड होंगे एज ए स्पीच लैंग्वेज पैथोलॉजिस्ट, ऑडियोलॉजिस्ट. तो फर्स्ट यू हैव टू go to this website, and then second step is search CRR. Scroll that, search, just try to find out where is CRR, and then once you click the CRR, and then you have to scroll and you need to go here, CRR registered, and after CRR registered you will be clicking, you will reach to here, click to search by CRR number, and then you can put CRR number of that person who is claiming he is a speech language pathologist and audiologist. For example, I am saying I am a speech language pathologist, audiologist and speech therapist. So if you want to know my CRR number, please go to the description of this live video. I have already given. The similar way, find some others. So once you put the CRR number and then you can submit. Once you submit, you will get registration status, qualification and registered as. तो कई बार टेक्नीशियन भी अपने आप के नाम में लगा देंगे कि वो स्पीच पैथोलॉजिस्ट, स्पीच पैथोलॉजिस्ट, ऑडियोलॉजिस्ट हैं, लेकिन जैसे ही उनके इन्फॉर्मेशन आप अगर डालेंगे तो वो आ जाएगा कि वो टेक्नीशियन है. तो सिर्फ सोशल मीडिया में नाम में लिख देने से एक स्पीच थेरेपिस्ट है, ऑडियोलॉजिस्ट है, आपको भरोसा नहीं करना है, स्मार्ट बनना है. इस डिजिटल मीडिया युग में कोई भी आपको बेवकूफ़ बना सकता है अगर आप स्मार्ट नहीं बनेंगे तो. तो ये मैंने कहाँ पे ये सारे इन्फॉर्मेशन डाला, वेयर आई हैव पुट दिस इन्फॉर्मेशन. सो दिस इज़ माय यूट्यूब चैनल्स कम्युनिटी पेज. सो दिस सो मेनी इन्फॉर्मेशन आर देयर. सो जस्ट आई वाज शोइंग फ्रॉम माय यूट्यूब चैनल कम्युनिटी पेज. सो दिस वंस यू स्क्रॉल इट यू विल रीच टू दिस प्लेस and you can just do this experiment. and सबसे पहली बात यह है कि जो प्रोफेशनल होंगे अपनी CRR नंबर के बारे में बताएंगे. तो दो तरह की बात हो सकती है. जो CRR नंबर नहीं बताता है, RCI CRR नंबर, तो इसका मतलब है कि he may be fake. and if he is telling somebody's CRR number and it may be wrong also. just to impress the people. I'm a speech pathologist, I'm audiologist, I'm just ABCD CRR number something is that. So once you follow these steps, once you will enter CRR number, so you will get all the information like उनकी पूरी जन्म पत्री आ जाएगी, रजिस्ट्रेशन स्टेटस, क्वालिफिकेशन एंड किस प्रोफेशनल के रूप में रजिस्टर्ड है. कई बार ऐसे भी होता है कि स्पेशल एजुकेटर है या साइकोलॉजिस्ट है या कोई दूसरा XYZ प्रोफेशनल हैं, बेरोजगारी में अपने फील्ड में अच्छा काम नहीं किया तो बेरोजगारी हो गई है तो दूसरे की फील्ड में हाथ पाँव मार रहे हैं, तो ऐसे भी लोग आपको मिल जाएंगे. तो देखिए कि वो किस रूप में रजिस्टर्ड है. ठीक है. और मैं ये मानता हूँ कि अगर आपके दांत में प्रॉब्लम है या फिर आपके दिल में प्रॉब्लम है तो आप कार्डियोलॉजिस्ट के पास जाते हैं. लेकिन दांत का डॉक्टर अगर वो डॉक्टर ही क्यों ना हो, दिल का इलाज करता है तो हम उसको क्या बोलेंगे, क्वैक ही बोलेंगे ना. अगर कोई एक सर्जन है, उसने वॉइस थेरेपी की ट्रेनिंग ले ली है, पढ़ाई नहीं की है, सर्जरी की ट्रेनिंग ली है, मेडिसिन की ली है, लेकिन वो वॉइस थेरेपी दे रहा है तो उसको भी क्या कहेंगे, हेल्थ केयर क्वैक्स ही बोलेंगे. भले ही वो पढ़ा लिखा डॉक्टर वाला है लेकिन किसी और फील्ड में घुस के काम कर रहा है, क्योंकि अपने फील्ड में अच्छे से काम नहीं किया, सीखा नहीं, तो दूसरे के फील्ड में लोग घुस के कई बार काम करते हैं. तो यू शुड बी वेरी केयरफुल एंड यू नीड टू चेक इट दिस स्टेप्स. तो अब हम आते हैं नेक्स्ट स्टेप पे जो हमारा प्लान था. आई एम जस्ट टर्निंग द कैमरा. यू मस्ट बी वेटिंग फॉर द लिसनिंग द पेशेंट्स वॉइस हु हैज़ कम फ्रॉम डिफरेंट प्लेसेस ऑफ इंडिया. सो आई विल बी कॉलिंग फर्स्ट यश. प्लीज कम यश. Yeah, take this. So yes, from which place you came and why you came? We are live at our YouTube channel. Just come little.
Hi, so my name is Ayesh. I'm from Bangalore. So when I talk on phone, sometimes opposite person will think I have female voice. Sometimes it is maybe out of 15 calls, two calls like that.
So how is it affecting your career and the confidence?
Like because of that, when I give presentation in office and all, sometimes I feel very low because of that voice. So
okay, so thank you for showing faith in us. And the next patient I'll be calling Harshal. Yeah. Please Harshal, come here. So Harshal, tell us what exactly problem you are facing. Why you came here? We are live at our YouTube channel. Yeah.
I came for high pitch voice problem. I am facing this problem from last 12 years. And also in offices, in presentation, I feel low and get very nervous.
What is your profession?
I am a sports administrator in Mumbai Cricket Association.
So how it's affecting your career?
Yeah, it affects a lot.
Okay, so thank you for coming, and we'll do the needful. And those who are watching this video, don't forget to watch, just come this side, and don't forget to watch the post-treatment live as well, and that we are going to do after 8 days of voice therapy. Yes. So next I'll be calling Yeshu. Yeah, so what exactly problem you are facing to us?
So I've been facing this puberphonia problem from...
Yeah, I think, what is your age?
My age is 25 years.
Yeah, so somehow at 25 years age, instead of puberphonia, I'll prefer to say that high-pitched voice, or we can childish voice. The reason is that puberphonia means, puber means puberty, phonia means something related to the voice. So if you could have come at maybe the 14 years age, 15 years, I could have preferred to say the puberphonia, but it's okay, no problem, let's go ahead.
So yeah, I've been facing this high-pitched voice problem from last 8 to 9 years. And the biggest problem I face in day-to-day life is that whenever any stranger call me, like they generally, say ma'am or madam. So obviously the confidence is very low, and I feel very hesitant in speaking.
Yeah, so after 8 days again we'll be doing the post-treatment live. So those who are watching this live, don't forget to watch the post-treatment live that we are going to do after 8 days. So from which place you came? Where is your native place?
So I'm from Rajasthan, but I'm currently doing a job in Bangalore.
Okay, great. So we'll do the info. And next I'll be calling Yeshu is there, no? Now Hari Singh. I think you are the last in this. Those who have given the permission. So just tell us what exactly problem you are facing, from where you came.
I am from Rajasthan, Shikhar. I am facing problem for right vocal cord. It's paralysis.
Yeah, because of the vocal cord paralysis, there is a dysphonia, a kind of voice problem.
My voice is breathing.
How your problem started?
By accident. I had a by accident at 10 January 2022.
So from 2022, you are facing the voice problem. And so have you taken any treatment?
No. I have some medicine.
So medicine for the name of the voice treatment or some other reason?
No, no,
For in the name of voice treatment, you have not taken any treatment.
no.
So what medicine you took? Why you took?
Swelling.
Okay, okay. Just for voice correction, no medicine you have
No
taken, no any treatment. So why you came to Bangalore? You were staying in Rajasthan.
I saw your video on YouTube channel and I think this is best way to.
Yeah. So those who are watching this video, you can watch in our playlist. There is a separate playlist for the vocal cord paralysis. He is having unilateral vocal cord paralysis, so you'll get an idea how the therapy works and what changes people can expect. Maybe those who are having or those people's loved one is having the vocal cord paralysis and dysphonia. So thank you. And after 8 days, we'll be doing post-treatment live. Of course, your treatment will be a little longer. We'll be doing hybrid mode. Few days will be in the Bangalore, and after that, we'll be giving online session as well. But those who are having curiosity, after 8 days, what changes happening, don't forget to subscribe our YouTube channel and pressing the bell icon. Thank you so much, and please have a seat. Yeah. So now I'll be talking different questions. I was discussing in the beginning. I'll be talking. So let's go one by one, and it may be helpful for the awareness purpose. So next is kind of service we provide. Okay, so to understand the kind of service we provide, my suggestion for those people who are new at our YouTube channel is please explore our YouTube channel playlist. You can see our YouTube channel here, and this I'm zooming it, so you can see here playlist. So once you explore our YouTube channel playlist, you'll find a different communication disorder playlist, and all the playlists will be having pre and post treatment videos, and we usually tell the date, so you'll be knowing how much time it took. So for example, if you explore our YouTube channel playlist, you'll find the playlist of vocal cord paralysis, high pitch voice, puberphonia, stammering, functional aphonia, functional dysphonia, and phonatory gap, sulcus vocalis. After stroke, aphasia happens, so that playlist, misarticulation, and after the fitting the proper hearing aid for the suitable people, how their communication improved. So all kind of playlists you'll be able to find it. So those who are new at our YouTube channel, don't forget to explore our YouTube channel's playlist. So this is my suggestion, and to understand what kind of service we provide. And next is high pitch voice sign, symptom, cause and treatment. So I'm just turning the camera towards me. So high pitch voice signs, symptoms, cause and treatment. First I'll be talking. So high pitch voice sign is very easy to understand. Like if you are a male and your age is more than 14-15 years, and when you are calling on the phone, people are saying yes ma'am sometime. Those are not saying to you. बिकॉज समटाइम पेशेंट से सर मैं जब सामने से बात करता हूँ ना तो मुझे लोग सर बोलते हैं, फ़ोन पे बात करता हूँ तो मैडम बोलते हैं, तो सिर्फ फ़ोन पर मेरी आवाज़ पतली आती है, बाकी तो ठीक है। बिल्कुल गलत। आपकी फ़ोन पर भी वही आवाज़ रहती है, सामने में भी वही आवाज़ रहती है। जब सामने बैठते हैं ना तो आपकी दाढ़ी मुझे दिख जाती है तो लोग सर बोल देते हैं, लेकिन जब आप फ़ोन कॉल पे होते हैं तो आपकी दाढ़ी मुझे नहीं दिखती हैं तो लोग मैडम समझ लेते हैं। वॉइस दोनों टाइम में सेम ही रहती है। तो ये जस्ट बताना चाहूँगा। तो हाई पिच वॉइस का साइन एंड सिम्टम्स बड़ा इजी, मैंने जैसे बोला कि प्यूबर्टी के एज का कोई अगर बच्चा हो गया उसके बियॉन्ड प्यूबर्टी और वो पतली आवाज़ में बात कर रहा है, लोग फ़ोन पे मैडम या कोई लड़की या कोई छोटा बच्चा समझ रहे हैं, दिस कैन बी ए सिम्टम ऑफ हाई पिच वॉइस। एंड द नेक्स्ट इज कॉज एंड ट्रीटमेंट। To understand the cause and the treatment, let's first understand the normal speech production mechanism. Once we understand the normal speech production mechanism, it will be easier for us to understand the abnormal. So for normal speech production, first thing is the thoughts that come in our brain. Okay, and after that we take air, that air goes to the lungs. Once we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. These are known as articulators. For example, if you are saying p, both the lips are coming closer together, touching each other. When you are saying t, tongue is coming between the teeth. When you are saying ka, back of the tongue is getting elevated and touching the soft palate. It means each and every sound has own place, own manner of articulation. When we say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. In one sentence there are so many words, in each word there are so many sound, each sound has own place, own manner of articulation. So it's quite complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency will be getting affected. That can be seen in case of stammering. Of course, in this group, there is no stammering patients. So it's in a very simple way. And now let's come to the high-pitched voice cause and treatments. As I told, here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar and sounds and rate. So during puberty, vocal cord mass length increases due to a hormone called testosterone in case of boys. So if the vocal cord mass length will increase, the vocal cord which was behaving earlier as a thin string of a guitar-like structure will start behaving like a thick string of a guitar-like structure. So when the guitar string will be thin, what will happen? Pitch will be higher, voice will be more shrill, but when the guitar string will be the thick, pitch will be lower. So before puberty, the vocal cord mass length is less, the pitch should be higher, but during puberty, because of the testosterone hormone, the vocal cord mass got increased, length got increased. So now it is ready to produce the low pitch voice. But few boys, what will happen for in those cases, their vocal cord mass length got has increased and it is ready to produce, but those guys, they have used their high pitch voice from childhood to puberty. And during puberty, the vocal cord mass length is ready to produce the low pitch voice, but they will not able to switch on to the new voice. The reason can be slightly psychological, or we can say the long time habit. So what they will start doing, instead of vibrating whole mass and the whole length, because of the long habit, they want to use their older voice. Instead of vibrating whole mass and the whole length of the vocal cord, they will start vibrating thin edges of the vocal cord. So once they will start vibrating thin edges of the vocal cord actually a thick string of a guitar-like structure, but still behaving like a thin string of a guitar-like structure, because only thin edges are vibrating, whole mass and the whole length is not vibrating. So what will happen? The voice that time will produce will be high-pitched voice, and even that will be continued beyond the puberty. Sometime people at the 55, 60 age also, they will be calling to me and they will be having high-pitched voice. And then we have seen during that time also the quite good changes after voice therapy if their body respond. So what we do in the voice therapy, because the reason you understood, instead of whole mass and the whole length of the vocal cord, that boy is vibrating thin edges of the vocal cord. So instead of thin edges, if I can stimulate whole mass and the whole length of the vocal cord, what will happen? The vibrating mass will increase, vibrating length will increase. The vocal cord which was behaving earlier as a thin string of a guitar-like structure will start behaving like a thick string of a guitar-like structure. And when the guitar string will be the thick, the pitch will be lower. So it looked like something magic. Some of my patients tell me a magician, but it's not a magic, it's a science. Earlier the patient was not vibrating whole mass and the whole length of the vocal cord. Now after treatment after voice therapy has started vibrating whole mass and the whole length of the vocal cord. So this is the biophysics behind that. So this can be the one reason when the nature has given the normal means your vocal cords are normal. Sometime what happened, those will delay the treatment, not all the patients, because the nature has given now the thick vocal cord. So ideally the voice should be low pitch, but you are using your vocal cord to produce the high pitch voice. So you are creating a stress or a strain. So what will happen because of this vocal abuse? There may be the sulcus vocalis, there may be the muscle tension dysphonia, sometime other problem may develop because of the vocal abuse. So my suggestion is, if you know that you are having such kind of problem, as earlier as if you can manage to treat. But again, the thing is, some patient will develop the vocal because of this vocal abuse, vocal nodule, or some muscle tension dysphonia, phonatory gap, sulcus vocalis. But some patient will be having still the normal everything. So those were having everything intact. So in those cases, I have seen quite impressive result. So my suggestion is, don't try self-treatment, don't take treatment from the healthcare quacks, don't delay the treatment. अब ऐसा इसको simple समझते हैं. We know that smoking can result into a cancer, but all the smokers will not be having the cancer. So even the vocal abuse may result into some voice disorder, but all the vocal abuse patient may be not be having. But the risk to hai na. Then why not you should take treatment from a certified professional at the right time instead of doing some self-experiment? Because I have seen those patients who have tried self-treatment or taken healthcare quacks, treatment from the healthcare quacks, they developed the phonatory gap, muscle tension dysphonia, sulcus vocalis. So this just I wanted to create awareness. And sometimes what happens, if you are taking treatment from a certified speech language pathologist and still you have not improved. Because many patients I have seen that those who have come from the Europe or you can say USA in our country. So do you think that they could have not tried in USA or UK and they directly came to our center? They must have tried there. But there was no improvement, here there was improvement. So do you think I'm a Superman? No. Because communication disorder, speech pathology field is a broad field. So maybe he has contacted to that person, that speech language pathologist may be expert in different communication disorder. For example, in speech language pathology field, we treat delayed speech and language children, misarticulation, after stroke aphasia happen, that also we treat. And so there are so many communication disorder, even the swallowing disorder we speech language pathologists treat. But with the time, what happened, different speech language pathologists will be having different interest for the different communication disorder. For example, I have the passion to treat the voice disorder. There may be some speech language pathologists, they may be working for the rigorously, or they will be having very much interest in the delayed speech and language in children, small kids. There may be some neurogenic communication disorder like aphasia. There may be some in the swallowing disorder. So you need to find that to whom you are taking treatment, he is really expert in the voice disorder, his area of interest is voice disorder. तो यही फ़र्क है. तो you need to find out. And अगर उनसे फ़ायदा नहीं होता है, अगर if you have taken treatment from a certified professional and you have not improved, immediately don't reach to a conclusion for, especially I'm talking about the high pitch voice, now you are not a good candidate for voice therapy and you should go for the thyroplasty. No, I'm not agree. You need to find people like me, those who are really having the passion to treat the voice disorder. Or if doesn't work, then you should think about the surgical option, because even after surgery also you have to go for the voice therapy. कहने का मतलब ये हुआ कि अगर वॉइस थेरेपी पर आपकी बॉडी रिस्पॉन्ड करती है और सही प्रोफेशनल से ट्रीटमेंट लेते हैं तो फ़ायदा हो सकता है, तो अगर ठीक हो गया तो हो गया. लेकिन अब आप जब भी सर्जरी कराएंगे तो सर्जरी के बाद भी वॉइस थेरेपी लेनी ही पड़ेगी. बिना वॉइस थेरेपी सर्जरी अपने आप में अधूरा है, तो क्यों ना पहले वॉइस थेरेपी ट्राई किया जाए. ठीक है. और कई बार ऐसा भी होता है कि लोग सर्जन से भी ट्रीटमेंट ले लेते हैं, वॉइस थेरेपी ले लेते हैं. तो मैं कहूँगा थोड़ा स्मार्ट बनिए, सर्जन से सर्जरी कराइए, वॉइस थेरेपिस्ट से वॉइस थेरेपी लीजिए. ठीक है. वो कई बार बेरोजगारी की वजह से कई बार कुछ भी हो सकता है, कई बार हेल्थ केयर क्वैक्स भी होते हैं. Yeah, I'm just coming to the vocal cord paralysis. So I just spoke to the high pitch voice, sign, symptom, cause and treatment. So now the question is about the vocal cord paralysis, sign, symptom, cause and treatment. So the vocal cord paralysis sign symptom is quite easy to understand. First thing will be the patient will be having a very breathy voice, because there will be gap between the vocal cords, so the air will be escaping, so the breathy voice will be there. Because air is getting vested between these two vocal cords, so the amplitude of vibration of the vocal cord will be less, the loudness will be less, and there will be hoarseness also, because both the vocal cords will be not be in unison, maybe in fact one will be not moving, and sometimes there will be partial movement in the in case of especially the paralysis. So this will be the symptom. Of course, to get the proper evaluation, the test we called is laryngoscopy to understand which vocal cord is not moving right or left. But with the voice also we can get any information. It may be the symptom of vocal cord paralysis after listening the voice, patient voice. And sign, symptom, cause and treatment. So I spoke about the sign and symptoms and the cause. So the vocal cord, to understand that, first let's understand a little bit the anatomy of the larynx and the speech production mechanism, biophysics of that. So as I told, here we have larynx. Inside the larynx we have two string-like structures known as vocal cords. So the vocal cord is a kind of muscle. It is getting supplied by a nerve, technically we call recurrent laryngeal nerve. That is a branch of vagus nerve, 10th cranial nerve. So that is supplying. Because of some trauma, if that nerve get damaged, the vocal cords movement will be getting restricted. Like your case was a bike accident. Like here we have one patient is Hari Singh. He has had a history of bike accident. During the bike accident, some injury happened in the vocal cord, and his right vocal cord got paralyzed. So this can be one reason. We can say the trauma. And the other can be during cardiac surgery or during thyroidectomy. Also I have seen that the nerve which is supplying the vocal cord will get damaged. So during surgery also it may be vocal cord paralysis may happen, because and the next is some viral infection or bacterial infection. Apart from that, there may be idiopathic. We are not able to correlate why it happens, so we call it idiopathic. So anything can be happen, and because of that vocal cord paralysis can happen. So the summary is vocal cord paralysis can happen due to trauma, during surgery, especially thyroidectomy and the cardiac surgery also I have seen. And sometime it may be happen bacterial infection, viral infection and idiopathic. This can be the reason of the vocal cord paralysis, and the voice will be breathy, voice will be hoarse, loudness will be less. And the treatment, so there may be the best, what I feel, the best way to treat the vocal cord paralysis is, the based on my opinion, first you should try the voice therapy. If voice therapy doesn't work, then only you should think about any other option. And when you get the vocal cord paralysis, sometime patient will be waiting, wasting the time. So immediately you should take the treatment, because when you are taking immediate treatment, the body respond better. Okay, so treatment, what we do in the voice therapy, suppose like your case, right vocal cord is paralyzed. So when we speak, like say both the vocal cord will be coming closer together, and at the same time vibration will also be there. So when the right vocal cord is paralyzed, the left is coming but right is not coming. So there is a gap between the vocal cord, and that is called phonatory gap. And because of the phonatory gap, lots of air is getting escaped, and because of the escaping of the air, so the air which was supposed to be utilized to vibrate the vocal cord will not be used, because anyway only one vocal cord is suppose one is paralyzed, so you are putting air below the non-paralyzed vocal cord, so the amplitude of vibration will be less, because air is escaping between the vocal cord, so amplitude will be less, so the loudness will be less. For example, you can understand the amplitude very easily. If a guitar string is there, if you are just doing like this with the small energy, the loudness will be less, but if you are doing like this, then there will be more loudness. So what you did in the second time, when you did more energy you put, the amplitude of vibration of the string was more. So here our vocal cord, if we consider like a string, like a structure, so air is getting wasted, the amplitude is less, the loudness is less. So what we do in the voice therapy, if suppose the right vocal cord is paralyzed, first we'll try to stimulate the right vocal cord so that it should start vibrating, and the gap between this vocal cord should reduce, and then the voice quality improves. But sometimes what happens, paralyzed vocal cord we are not able to move. So in that case, what we do, normal vocal cords we try to bring towards the more paralyzed one, so that gap between these two vocal cords should reduce. When the gap will reduce, what will happen? Amplitude of vibration will be more, because air wastage is getting reduced, so the voice quality improve. So anything can be happen. I have seen many patients, those paralyzed vocal cords started moving, and there are few patients paralyzed vocal cords was not moving, but still the voice quality improved, because the normal vocal cords came towards the paralyzed one, and our therapy reduced the gap between these two vocal cords, and the voice quality improved. So those who have the curiosity to understand more, like how much changes happen in our vocal cord paralysis patient, there is a special playlist in our YouTube channel. Please explore that, so get an idea. And we tell before treatment date, after treatment date, so you'll get an idea, those who are new at our channel, how much time it took, how much improvement happened. So I think you got the idea. So let's go to the next. Is there any side effect of voice therapy or self-treatment? If you are taking treatment from a certified professional who are expert in treating voice disorder, there is no side effect. But when you are taking self-treatment or treatment from the healthcare quacks, there may be a damage in the voice and the vocal cords. How to contact us? Our contacts details are in the description of this video, and nowadays I am uploading many shorts. So in the average, many of the shorts we have given the contact number also. So explore our shorts or description of this video. And do we have accommodation facilities at our centers? So we don't have the accommodation facilities, but our team will be supporting you to get the accommodation near to our center. Next is which treatment is preferred first, voice therapy or surgery for pitch correction? Based on my experience, I prefer first you should try voice therapy. If voice therapy doesn't work, then only you should think about the thyroplasty and all. And already I discussed, if one therapist is not able to help, immediately don't get conclusion that you are not meant for, or you are not a suitable candidate for the voice therapy. You need to find out expert, those who are really expert in treating voice disorder and the voice therapy. So, and even after surgery, you need the voice therapy. So first preferred method is voice therapy. So do we have any branch of our center? So till now we don't have any branch of our center. Our center name is Sanjay Speech Hearing and Rehabilitation Center, and that is located in Bangalore. That is only one center till now. And if you do the Google search, you can easily find out, or you can refer the description of this video. Cost and duration of treatment for voice and speech disorder. The cost and duration may vary. So we suggest the patient to first call us. We do the perceptual evaluation, and after the perceptual evaluation, we give some ideas about the cost and duration, expected outcome, etc. How do we treat international patient, online or offline? So we treat our international patient both the way, online as well as offline. So first we decide after the perceptual evaluation who can be a good candidate for like online or who can be a good candidate for offline. Is saying 1 2 3 or saying in your voice is stage of treatment or end of the treatment? तो कई बार सोशल मीडिया में ऐसे वीडियो देख रहे हैं कि पहली बार पेशेंट जो है आ बोल दिया पतली आवाज़ में, अगली बार आ बोल दिया मोटी आवाज़ में, पहली बार आ बोल दिया एक हॉर्स वॉइस में या कुछ में भी, और दूसरी बार बोल दिया मतलब एक थोड़ी बेहतर आवाज़ में. तो दैट कैन बी ए स्टेज ऑफ ट्रीटमेंट. एंड ऑफ ट्रीटमेंट पेशेंट शुड एबल टू टॉक, ही शुड मेक द सेंटेंसेस. कहने का मतलब ये हुआ कि कोई भी अगर वीडियो में आप 1 2 3 पे चेंज देख रहे हैं तो वो एक जो है वो क्या है, स्टेज ऑफ ट्रीटमेंट है. एंड ऑफ द ट्रीटमेंट का मतलब क्या हुआ कि ही शुड एबल टू टॉक इन सेंटेंसेस. अगर वैसा नहीं दिखता है तो आपको इंप्रेस होने की ज़रूरत नहीं है वैसे वीडियो से. अब कहने का मतलब आपको जाना है दिल्ली और कोई आपको गाज़ियाबाद पहुंचा दिया तो उसको दिल्ली तो नहीं बोलेंगे ना. दिल्ली पहुंचाने की बात हुई थी तो दिल्ली पहुंचना चाहिए. तो जब बात हुई थी दिल्ली पहुंचाने की तो गाज़ियाबाद को में पहुंच के क्यों बता रहा है कि हम दिल्ली पहुंच गए हैं. वैसे वीडियो से सावधान रहने की ज़रूरत है. इज़ वॉइस थेरेपी रिजल्ट इज़ परमानेंट? तो कुछ ऐसे कम्युनिकेशन डिसऑर्डर हैं जिसमें मैंने रिलैप्स देखा है, जैसे कि स्टैमरिंग के केस में कभी कभी ट्रीटमेंट के बाद रिलैप्स हो जाती हैं, कभी कभी स्पास्मोडिक डिस्फोनिया के केस में रिलैप्स हो जाती हैं. तो इस ग्रुप में ना ही कोई स्टैमरिंग के पेशेंट हैं ना ही कोई स्पास्मोडिक डिस्फोनिया के हैं. तो जो लोग भी हैं जिनको भी वॉइस फ्यूचर में जो भी अचीव करेंगे ट्रीटमेंट के बाद, टिल नाउ बेस्ड ऑन माई एक्सपीरियंस आई एम एक्सपेक्टिंग इट शुड बी स्टेबल. और मेरे यूट्यूब चैनल के कमेंट बॉक्स में बहुत सारे कमेंट्स आते रहते हैं कि सर वंस आई विल गो आफ्टर दिस रिजल्ट इज़ परमानेंट. So I was getting very frequently this question. Then I thought, let's give the answer. If I'm giving the answer, patient will be thinking, sir, just want to give some positive hope. Then I thought, why not I should do live with my patient to whom I have treated 7 years, 8 years back. So I did live with those kind of patients, and in fact I suggest watch this 35 minutes video. If you go to the description of this video, you will find those many links. So, and their experience, they are telling the experience after the 7 years, 8 years treatment. So those have the curiosity, please refer our those 35 minutes video description, and my patient themselves are telling that how their voice is. So just do some research, I am suggesting, and to know that is voice therapy result is permanent. ऑफ कोर्स थोड़ा मैं बता ही देता हूँ कि जो पिच की प्रॉब्लम है, लाउडनेस की प्रॉब्लम है, इवन द वोकल कॉर्ड पैरालिसिस की वजह से डिस्फोनिया है, अगर हमने एक बार ट्रीटमेंट किया, पेशेंट की बॉडी रिस्पॉन्ड करती है तो जो चेंजेस होते हैं वो स्टेबल होते हैं. लेकिन इसके डिटेल की में जो जानकारी है वो उस वीडियो के बारे में जो मैंने बताया वहाँ पे एक बार एक्सप्लोर करना चाहिए लोगों को. इफेक्ट ऑफ फूड एंड ड्रिंक वॉइस, तो इसका इम्पैक्ट पड़ता है हमारे वॉइस पे. तो तुरंत खाना खा के सोना नहीं चाहिए. इमीडिएटली आफ्टर योर डिनर डोंट स्लीप. द एसिड विच विल फॉर्म टू डाइजेस्ट द फूड will be accumulated at the level of the throat, and that may damage your voice and the vocal cord. So there should be 1.5 hour to 2 hours gap between your dinner time and your sleeping time. And if you are drinking very cold things, so vocal cord is a kind of muscle, so that will be affecting your voice quality as well. And then next is announcement of next batch of group therapy. So our next batch of group therapy is going to be started on 8th April 2024. And next is who are the good candidate for voice therapy. So this is a very interesting question. So before coming to our center, if you are thinking that it will be wastage of time and money, then you are absolutely right. And if you are thinking before coming to our center, our service may help you, then also you are right. इसका आंसर यही मैं कहूँगा. Is all high pitch voice or female voice is puberphonia? So that already I have discussed. High pitch voice can be a symptom. जैसे कि फीवर होता है, तो फीवर क्या हुआ, एक सिम्टम हुआ. दैट कैन बी वायरल, दैट कैन बी बैक्टीरियल, दैट कैन बी एन नंबर ऑफ रीजन इफ यू टॉक टू द फिजिशियन. द सेम वे हाई पिच वॉइस कैन बी अ सिम्टम. इट कैन बी, एज आई टोल्ड, ड्यूरिंग puberty vocal cord mass then got changed, you are not able to switch on to the new voice. That can be one reason. There can maybe some muscle tension dysphonia, there can be phonatory gap, there can be sulcus vocalis. I have read in my textbook there can be hormonal issue also, testosterone hormone, but I have not met till now any single patient. So but based on my textbook, that can be also the reason of high pitch voice. So understanding the reason and based on that treatment is important. So that's why I tell always take help from a certified professional who are really expert in treating voice disorder. Next is online facilities for communication disorder at our center. So that we decide based on the perceptual evolution. So if you have the curiosity about your problem, online therapy will online therapy will be helping you or not. Especially the online voice therapy will be helping you or not. please call us for perceptual evaluation, and our contact details are in the description of this video, especially on our website. Next is online facilities for communication disorder at our center. So for that, I'll be suggesting you please call us. We'll do perceptual evaluation, then we'll decide you are a good candidate for online or not. एंड टिप्स टू कीप योर वॉइस हेल्दी, तो अपनी वॉइस को हेल्दी कैसे रखते हैं इसके बारे में मैं थोड़ा टिप्स देने वाला हूँ. ड्रिंक प्लेंटी ऑफ वाटर. वाटर इज़ अ वेरी गुड lubricant for your vocal cords, and the water should be at the room temperature. Avoid frequent throat clearing. If you are doing frequently like so because of the friction between these two vocal cords, voice and vocal cord may damage. So avoid frequent throat clearing. Avoid whispering. If you are talking like this, my name is Sanjay Kumar, something when you are doing is whispering, you are creating a stress on the vocal cord. So avoid whispering, avoid shouting, and if you have any kind of voice problem for more than 2 weeks, just consult a certified professional to understand the reason. Do some jogging, walking, and some yoga or physical activity or gym, something. When your stamina will be better, you can put sufficient air pressure below the vocal cord and you can produce some good quality of voice. So I can say that some physical activity you should do, and avoid very cold thing, and to keep your voice healthy. And have very interesting story for about the vocal abuse. There was one patient who came long back, I think it's near in the year 2010, what I remember. And when I asked how the problem started, he was having spasmodic dysphonia. Then he was telling, I had some throat infection, and after the throat infection I went to meet an ENT doctor, and ENT doctor suggested some medicine and even asked him to take some voice rest for maybe 1 month. And he misunderstood voice rest, and what he did, he just started whispering for those 1 month, and after the 1 month whispering was there, as sometime voice was coming. Even that videos is also there in the 2010 very beginning videos, if you can explore at our YouTube channel, initial videos. And then sometime voice was coming, most of the time only the whispering was there, and based on my knowledge, he developed this spasmodic dysphonia that is very, very challenging to treat, and we gave voice therapy. And before coming to our center, he just went to all the professional what exist, all the medicine पद्धति जो भी होते हैं, होम्योपैथी, आयुर्वेदिक, एलोपैथी, न्यूरोलॉजिस्ट, ENT डॉक्टर, जितने सारे होते हैं सबके पास, मंदिरों में गया, ओझा झाड़ फूक वाले लोग होते हैं, ब्लैक मैजिक, सब जगह जाके. So just you can think that how the vocal abuse can just spoil your vocal cord. He did whispering for 1 month, and after 1 month he was having only whispering. So your voice and vocal cords are very, very important. You should take care of that, and always take help from the certified professional. So these are the few tips I wanted to share with the people. And drink plenty of water, as I told. 10 से 12 ग्लास तक पानी एक दिन में पीजिए, रूम टेम्परेचर वाला पानी पीजिए. That is very good for your vocal cords. So just and those who are having the curiosity how much the voice got changed, those patient who has come, I'm just showing the videos here. These are the guys who came for different voice problem. So and actual number of patients are more. So if you are not comfortable with the videos, I am not showing to them in the live. So don't forget to watch the post treatment live, and that we are going to do after 8 days. So thank you all for joining us and watching us. I'll just check few questions if are there. I'll be answering now. I'm free. So just हाँ, कुछ क्वेश्चंस अगर आ रहे हैं तो लिखते हैं. क्रेजी ब्लॉग नॉर्थ ईस्ट लिखते हैं. हेलो सर, हाउ आर यू सर? आई एम दीपांकर ब्रोडोल फ्रॉम आसाम, गुवाहाटी. सो थैंक यू. हाउ आर यू, दीपांकर? And next is instant updater is saying, I take online therapy from you after my exams are over. I will take. Okay, instant updater, we first do perceptual evaluation, then we decide you can be a good candidate for online voice therapy or offline voice therapy. So please call us, we'll do perceptual evaluation, then only we'll decide. Next is instant updater. I'm from Jammu and Kashmir, so I can't visit your clinic, but there is a limitation for communication disorder, because like surgery can't be done by online method. So same way in certain communication disorder, my finger and patient larynx both should be present in the same environment. So everyone is not suitable for the online voice therapy. And next is crazy blog. My crazy blog is saying Northeast. I'm my taking your therapy. I'm very thankful to you. You have given me new. Okay, I think maybe some old patient is saying my by taking your therapy in great with my voice. I'm very thankful to you, sir. You have given me new life. You are the India's #1 voice therapist. Thank you. Thanks for your love and just recognizing my work and appreciating my work. Thank you so much, Crazy Blog Northeast. And next is एड्रेस कहाँ है आपका हॉस्पिटल का. तो इस वीडियो के डिस्क्रिप्शन में जाइए, और नहीं तो यहाँ पे भी जो हमारा पीछे में वेबसाइट दिख रहा होगा ना, हम अगर देख रहे होंगे स्पीच इधर दिख रहा होगा, इस वेबसाइट को क्लिक कीजिए, फिर रिच मी पे जाइए, आपको मिल जाएगा डिटेल कहाँ पे है क्लिनिक. और नेक्स्ट इज आलोक यादव लिखते हैं, सर हम यूपी से हैं, अगर हम अपना वॉइस का इलाज कराना चाहता हूँ तो बिल्कुल आपका स्वागत है हमारे सेंटर पर. लेकिन उससे पहले मैं चाहूँगा कि आप हमें कॉल कीजिए, हम परसेप्चुअल एवोल्यूशन करेंगे और तब फीडबैक दे पाएंगे कि हम आपको हेल्प कर पाएंगे या नहीं कर पाएंगे. तो पहले काम ये कीजिए कि आप हमें कॉल कीजिए परसेप्चुअल एवोल्यूशन के लिए. परसेप्चुअल एवोल्यूशन का मतलब ये हुआ कि हम आपकी आवाज़ को सुनेंगे. हो सकता है सुनने के बाद कुछ टेस्ट के लिए भी रिकमेंड करें हम. Thanks Ratnesh Yadav ji for joining and watching us. Thanks Ajay Joshi for joining us and watching us. And Burhan लिखते हैं online therapy is possible. So of course it's possible, but not for all communication disorder. So we want to do the perceptual evolution and then we'll decide you can be a good candidate for online voice therapy or not. Next is commenter. Sir, when will be a new batch start for high pitch voice? Our new batch is going to be started on 8th April 2024. This is the information for you. The next batch is going to start on 8th April 2024. So thank you all for joining us and watching us. कुछ और क्वेश्चन है तो आप पूछ सकते हैं, मैं उसका उत्तर दूंगा. और नहीं, आई थिंक अब क्वेश्चंस नहीं हैं. थैंक यू ऑल फॉर जॉइनिंग अस एंड वाचिंग अस. मैं एक बार कैमरा टर्न करता हूँ, आप लोग हाथ हिला के हाई कर सकते हैं. जो भी लोग पेशेंट्स आए हैं डिफरेंट जगहों से, अब हम इस लाइव को स्टॉप करने वाले हैं. ठीक है, तो दिस आर द पेशेंट हु हैज़ कम फ्रॉम डिफरेंट प्लेसेस. एक्चुअल नंबर ऑफ पेशेंट्स आर मोर, but if you are not comfortable with the videos, I'll be not able to show them. So thank you all for joining us. Thank you all, love you all. We'll stop this live. If you have any question that answer I have not given, please write in the comment box. We'll give in the next live. Thank you all, love you all.